Hi, this is Dr. Shaina. Make sure to like and subscribe. That way you can get tips from the HealthFit team on anything else. So one of the questions is, why do I have popping or clicking in my hips or my low back, especially when doing core exercises? One of the exercises that you might have some of the clicking and popping with is, let's say, the abdominal bicycle. As you're twisting and reaching and extending the leg, you might hear clunk, 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 or pops in the back. There's also the other type of popping that might be like cracking a knuckle. Some people twist and they feel click, 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 click. Other side, click, 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 click. Some people says it feels good. Other people say they have to do it all the time because they feel tension in their back. They need to do it to feel a release. So, is this clicking and popping bad? Not inherently if there's no pain. However, it might be a sign of an underlying issue. Some of the clicking could be like popping your knuckles. It's just a release of air from the joints. Or it could be strumming of soft tissue over bony prominences, like your hip flexors over some of the bony prominences in your hip. The reasons for some of this clicking and popping might be active instability issues. So you might not be able to control your core and stabilize well in the right pattern, and then the hip flexors take over. So you have some dominance in hip flexor activation, which are the front of the hip muscles that lift your leg up in front of you, over truly stabilizing the trunk. Sometimes breathing strategies can be part of the reason why you can't activate your core well. Sometimes the exercise might be too difficult for your actual level of core stabilization strength, possibly because some of those other patterns you have may be dominating. You may find that you do tons of core work, but it doesn't go away. So it's not necessarily what exercises you do, it's really how you do them. One way to look is if you do that abdominal bicycle exercise, what I demonstrated before, but then you flip over and you do a different core stabilization exercise like the bird dog, and you don't have that same clicking or popping, you have opposite hip muscles against gravity. So it might tell you maybe your hip flexors are the ones that are. So when you compare the two different exercises, both are some level of core and trunk and pelvic stabilization. Maybe it's some imbalance of your hip muscles on one side versus the other in relation to how you engage your core with it. So like I said, it's not necessarily what exercises you do, but how you do them. It's motor training, it's stabilization, it's positional patterns, it's muscle recruitment patterns. All of that ties into how you move, and the movement is purely an experience of brain and body, body and brain together. It's actually so great that the body can compensate and the body can do things in so many different ways. But if that's the only way where you can't get rid of that clicking and popping and you can't stabilize in the way where you can balance out some of the muscle recruitment, then maybe that might cause issues later. Because if you consistently do that same pattern, that might lead you to overuse because you can't vary it up and use other muscles to help out. If you're having issues with clicking and popping, maybe call in and get assessed. That way we can see exactly what are the underlying issues that you might have with your body so that we can fine tune it and make sure that it works really well and make sure that you can truly stabilize your core rather than just using those superficial abdominal muscles around it to help you better function and move around without compensatory strategies. Thanks for watching and check out our other great tips.